Alzheimer's disease is the most common cause of the neurodegenerative disease dementia and is one of the main reasons of disability in later life, ahead of cancer, cardiovascular disease, and stroke. In 2015, there were over 850,000 dementia patients in the UK, with half of them requiring additional care and attention. But that year, dementia claimed around 60,000 lives. 49% of hospital admissions within the borough of Islington were preventable. However, the UK spends significantly less on Alzheimer's than several other diseases. The Islington NHS CCG spends over £1 million a year on hospital visits, but what exactly is Alzheimer's and how does it affect patient care?
Alzheimer's is a devastating neurodegenerative disease affecting memory, language, and impairing daily activities. Scans of the brain show that there's degeneration in the hippocampus, the cortex, and the ventricles. Progression of the disease is slow, but it does eventually lead to death. We estimate 20% of the population aged 80 or over are affected by Alzheimer's. Usually these patients are started on acetylcholinesterase inhibitors. These patients tend to be quite elderly, and they have comorbidities, which means that medicine regimens are quite complex. A lot of the time, what tends to happen is patients and carers get overwhelmed. They don't take the medicines properly, and that's when non-adherence leads to hospitalization.
Alzheimer's Allies aims to tackle medicines wastage associated with patients suffering from Alzheimer's. This innovative service will increase patient contact with healthcare professionals, allowing for more personalised care and effective medicines reconciliation. The Alzheimer's Allies service involves 3 simple steps. 1. Initial consultation with Associate General Practitioner. Patients will be screened for eligibility and recruited to the service. Within 4 weeks of the consultation, a personalised care plan will be put in place for them. 2. Our pharmacists will make home visits to participants twice a month. They will perform qualitative and quantitative assessments with the aim of optimising medicines usage. They will be continuously updating relevant information resultant from the home visits on the digital patient medical records. 3. A shared decision-making process between healthcare professionals and the patient, making relevant interventions or adjustments to care plan of patients based on professional judgment and the latest local guidelines. Our pilot is projected to save over £100,000 per year, which will multiply once expanded to the rest of the country. The social and financial aspects of our service cannot be overemphasised, as our personalised care approach will be tailored to the individual needs of the patient and carer. Patients will benefit from conversations with healthcare professionals who are sympathetic to their situation, and our approach will not only increase patient confidence in the NHS, but will also reassure them that they are not alone. We aim to improve the quality of life in our patients by slowing their transition into a care setting, and that is Alzheimer's Allies.